But I do rise in opposition to 1868. There was no effort made on the part of the majority party to work with Republicans on what should be a bipartisan priority, and that is provider relief. I've heard from physicians, I've heard from hospitals in Texas who've struggled financially throughout the pandemic. But the bill we have before us today is simply an excuse to wipe out the scorecard of the fiscal impact of the $1.9 trillion partisan package passed last week. And last week, Republicans warned that this would threaten cuts to Medicare, but those warnings were repeatedly ignored. So look, if the House majority really cared, if House Democrats really cared about meaningful health care provider relief, they would have worked to gain Republican support, worked with us to build the bill from the ground up. Instead, this bill is coming toward us as a Hail Mary pass right before the Medicare sequester cuts go into effect in April. As a physician, I have deep empathy for those whose medical practices have been impacted and are now struggling to stay open. I know I've helped many doctors, many clinics navigate the Provider Relief Fund over this past year. We need targeted relief for the providers that are hurting, and some are hurting more than others. So I am a co-sponsor of H.R. 1999, which is an alternative approach that adds over $12 billion to the Provider Relief Fund and ensures that dollars would flow to those doctors who've experienced lost revenue or increased cost. This type of financial relief has already been proven successful. We passed the CARES Act on the 27th of March last year. We know it's successful. Additionally, this alternative bill ensures that the 4% cut to Medicare providers that was included in last week's reconciliation bill as a result of statutory Paygo does not go into effect in 2022. The American Rescue Plan Act gifted $350 billion to state and local governments that simply was not justified. Providers, our state and local communities are worthy of funding, and they should specifically benefit from those state and local dollars that are not necessary to go where they're planned to go. That's why we would like to redirect the state and local funding towards provider relief. Maintaining a strong healthcare workforce is critical to the health of this nation during normal times, and is especially critical during a public health emergency. We should work together on the right policy solution to deliver this relief to ensure that it stands a chance of actually passing in the other body, and that should be a starting point for those discussions. And I hope we can come to such a sensible solution. I yield back to the gentleman from Missouri.